Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
And today I'm presenting a topic explained by Paulien, a Belgian nuclear medicine resident.
In this video, we will discuss radiation units in the simplest way possible. When Zubair first learned this topic,
It's very frustrating because there were no clear explanations available online.
So today, our goal is to make this concept easy for you and save you from the same confusion.
Canada uses the ETH units as the SI of units for radiation measurements,
Whereas the USA still uses a mix of SI and older conventional units, which can sometimes cause misunderstanding. When we talk about radiation, we usually refer to two major concepts. One, activity, 2-point exposure.
Activity describes how much radiation is being emitted. Exposure tells us how that radiation affects whatever absorbs it. Activity measures the rate at which a radioactive source emits radiation.
The SI unit of activity is the Becquerel, which represents 1 radioactive decay per second.
An older unit that is still commonly used is the Curie-Porens, which equals 37 billion becquerels.
Activity only tells us how much radiation is being emitted. It does not tell us how much radiation is being absorbed.
To understand how radiation affects matter, such as Caucasian male human tissue portrait, we use 3 important exposure-related measurements.
1. Absorbed dose. 2. Equivalent dose. 3. Effective dose. Absorbed dose tells us how much radiation energy is absorbed by a material, bone, muscle, air, etc.
It does not indicate how harmful the radiation might be. It only tells us how much energy was absorbed.
the unit of absorbed dose is the gray, Joule, defined as
1 Gui, 1 joule of radiation energy absorbed per kilogram of material.
As an X-ray beam passes through the body, tissues closer to the surface absorb more dose than deeper tissues.
In a CT scan of the upper abdomen, the chest receives only minimal scattered radiation, while organs like the stomach and liver absorb a much higher dose. Equivalent dose. Different types of radiation cause different levels of biological damage.
Absorbed dose alone does not show this difference.
To account for radiation type, we use the equivalent dose, which applies radiation weighting factors.
Examples of weighting factors: X-rays, gamma rays, beta particles 1. Alpha particles 20 times more damaging.
The unit for equivalent dose is the Sievert 10.
In diagnostic imaging, X-rays, CT, and nuclear medicine, the types of radiation used have similar low biological impact.
The absorbed dose and equivalent dose have the same numerical value, only the units differ.
Effective dose. Different organs have different sensitivities to radiation. Organs that divide rapidly are more sensitive.
bone marrow, stomach, lungs, colon, breasts.
These organs have higher tissue weighting factors, Lesime.
Less sensitive tissues, like the skin, may have weighting factors like 0.01. Less sensitive tissues, like the skin, may have weighting factors like 0.01.
Absorbed dose equals 10 mSv. Equivalent dose equals 10 mSv. Thyroid tissue weighting factor equals 0.03.
Effective dose, DENS, DRUS, dental, I 0.03, 0.3 millisasves.
Quick recap. Activity, amount of radiation emitted from a source.
Absorbed dose, how much radiation energy is absorbed. Equivalent dose, absorbed dose adjusted for type of radiation.
Effective dose, equivalent dose adjusted for tissue sensitivity. Overall risk,